So firstly, I am the CEO of Apollo Radiology International and the director of ARI Academy. ARI Academy has been formed about 4 years ago now, and with an aim to try and bring international education to Indian radiologists. The first thing we did is to try and correct the situation with the FRCR exams, where people, radiologists in India, have been waiting for years to get the place in the exam and spending literally tens of lakhs of rupees in trying to complete the exams. So with the help of Ash here, we both try to convince or manage to convince the Royal College of Radiologists to have a center in India. And as you will be aware that we've been conducting these exams now for 2 or 3 years successfully, and the radiologists who took the exams in India were able to avoid all the cost and hassle associated with the exams, with going to London, etc. Now, that was the start. We then tried to expand the scope a bit more with the same ethos of trying to make sure Indian radiologists get the best training that they deserve. You all, I think, are either in training or practicing radiologists, and you will agree that despite people in India who choose radiology, doctors who choose radiology, being one of the brightest in the field, most of them end up completing their training feeling somewhat incomplete in terms of the training they achieved. The reason has got nothing to do with the individual, and usually not to do with the institution, but it's the fact being that the duration of training is just too short to become a competent, fully trained radiologist. See, 30, 40 years ago, when there was only X-ray, ultrasound, and maybe some basic CT, 3 years was adequate to become a trained radiologist. But radiology has completely transformed in the last 20 years. So to feel confident enough to report on a wide variety of modalities and organ systems in 3 years is just not possible. So as you know that once the MD DNB is finished, most radiologists try to do a variety of things, working in a corporate hospital or working as a senior resident in some government institution is one of the things that are being done. But there are very few structured training programs that try to fill the gap that most radiologists feel. And going abroad is an option that a lot of radiologists try to do, but even that, as you know, is extremely difficult because our CVs tend to be a bit incomplete. And when you're competing with the local radiologists for fellowships, etc., usually we struggle to shine through. So that's the reason why we designed this program. This is a very carefully designed, comprehensive 2-year program that goes through all the radiology modules very carefully, chapter by chapter, trying to address all the core aspects of radiology using some of the best faculty that you can think of. Professor Chakraborty will go more in detail about how the program is structured. But the idea is that whether you are a trainee in your second year or third year, whether you are a junior radiologist, once you do the program, we are fairly confident that you feel confident that you are a competent, well-rounded radiologist that can do great service to patients in India if you are here, but also provide you an opportunity to pass international exams like FRCR, EDR, etc., with a lot more competence and more easily. And if you want to go abroad and work there, then with the help of these qualifications and with the help of the training and your personal resume or the CV being boosted significantly by testimonials and certifications from all these international experts, that you will be able to obtain a good rewarding position or a training position or a service position in UK, USA, etc. So that's the idea behind this program. And as I said, this is the initial introduction, and once Ash speaks, then we'll open the floor for questions. Thank you. Over to you, Ash.
Thank you, Raju. So what I'm going to say is might sort of slightly overlap with my colleague Raju has already said. So whenever you start a new program, there are a few basic questions, isn't it? One is that why do we need it? Number two, what is it? And number three, what are the benefits you get out of it? Why do you need to do it? So I'll try to tackle each of them individually. So as Raju has already alluded to, one of the main problem with the training in not only India, in a lot of other countries as well, is the duration of the training. So, we cannot do anything about the duration of the training. It's more of a political decision. So what we can do is to see where the gaps are and what we can do about it. So as I was saying that I have been involved, I've been the chair of FRCR exams in the Royal College. I've been involved with setting up trainings, quality assurance of the training program. I've also been involved with the curriculum development by the Royal College of Radiology. I was also chair of professional learning and development. So over the last 2 decades of doing all this work with the Royal College and in Oxford as well. In Oxford, I'm also professor and head of Department of Radiology for Oxford University in Oxford Medical School. So all these academic attachments have given me an insight of how to set up training and why is it necessary. So most of the training in UK or USA or any other countries have got at least 5 years. And those 5 years, what we do, the first year is more like introduction to radiology, anatomy, physics, techniques, and also getting to know how to establish yourself. The second and third year is very crucial. And it's probably the most important part of the training, what we call as core radiology training in the UK. During this time, the candidates go for about 3 to 4 months in each part of the radiology department. By each part, I mean, say, MSK, chest and cardiac, GI, including hepatobiliary, GU, including gynae and obs, pediatrics, breast, and so on and so forth. So while rotating through this program, the candidates become conversant with the core radiology training and what to do to become a safe and competent radiologist. And at the end of this training, the candidates in UK would sit for their FRCR exams. And then the last 2 years, the year 4 and year 5, is spent in doing the subspecialty training. I mean, even if you are a general cross-sectional radiologist, that is also a subspecialty. So in whatever is your chosen subspecialty, you will get further training for 2 years, at the end of which you get CCT, which is equivalent to your MD or DNB, after which you can practice as a radiologist. So if we look at that model, so what we can do is the first year is going to be the training which is going to be provided by your MD or DNB program. And I think that does not need to be replicated. But the main issue is this core radiology program. That's the cornerstone or the foundation to become the good radiologist. And that is what this course is trying to provide, is providing this 2-year course running in the similar fashion as the training would run in UK or USA or Australia or Germany or France, and to make sure that you become a competent and good radiologist. After that, we are also going to offer mini fellowship programs, which will supplement the year 4, year 5 training that you have in the Western countries. And that will be for you to take up. So what benefit do you get out of it? So if you do this core radiology training program, it gives you the launching pad for a number of things. The number one, as Raju has already told you, is that first of all, you become a radiologist who will provide a good service to your patients. I think that is very important. The patients can be in India, which I believe will be in case of most of you, but also if you plan to work abroad, it will be the patients there. The second benefit, it opens up your employment opportunities, whether it's employment in India or in abroad, wherever you want to work. And there what you will have is the credentials that you have undertaken a training, which is structured, which is based on a solid curriculum, and At the end of the training program, you will not get only a paper certificate which you can frame and put up on a wall, but we will also give you a detailed digital report which you can attach to your applications or anywhere you are applying for a fellowship or you are applying for a job, which will in details tell you what you have gone through during this program. The fact that you have gone through each of the modules in all the details and that you have been taught by the world's most famous people will definitely add a lot of value to your application, whatever you are applying it for. So in that way, your capacity to earn more will also increase because your employees will know that, that this candidate is better than rest out of the others because this is the credential this candidate has. And finally, this program will also be the springboard with which you can take subspecialty training, be it in the mini fellowships that we are going to organize or elsewhere. So it has got multiple benefits, which I think will be quite valuable for all of you. And what it does is that your training then will be at par with any registrars or any trainees anywhere in the world, in the best of the best countries. And that will put you at par. And that is going to be a very important aspect. And that's why we are calling as you will become from just an Indian radiologist to a global radiologist. Your capacity, your training, your credentials will be at par with anybody else in the world. And that is the aim of this program. The final part, which I will elaborate, is that how we are going to structure this program and how will it be for you. So the duration of the training, as we mentioned, will be about for 2 years, because that is the time we will need to ensure that you have gone through each part of the syllabus. As you know that we are going to invite applications from anyone, any trainees who have at least done the first year of training program. As I said, the first year is more the basics of radiology, which you gain the experience from your local training program, and then you join this program. We are also opening it up for candidates who have passed their exams, got their MD or DNB, but within say 5-6 years of their passing the exam, because the longer duration you give, the more difficult it becomes to start a training program again. And then we are going to take you through this core curriculum. Now, the backbone of any core curriculum and any core training is the syllabus and the curriculum itself. So as I said, I have got experience and we have drawn inspiration from the curriculum that is used in UK, in America, and created a bespoke, detailed, and up-to-date curriculum for this whole program. And we will adhere to that program in all details while we are providing the training to you. As regards the amount of time you will need to devote for this program, what we expect that you will be devoting about 6 hours per week for this program, out of which 4 hours will be what we call this passive learning and 2 hours will be active learning. What I mean in the passive learning is that you will be able to do it at any time that you want, but all your activities and your participation will be carefully monitored by the analytics that we can get from the websites and from the softwares. So we will ensure that you are going through the program with as much of discipline and effort that we expect you to do. And the active learning will be when you are directly in contact with your trainers. So how, for example, if I give you an example of 1 week, say, for example, you are doing the MSK module and you're doing knee trauma. So the passive week will start by you having some reading material which you will have to go through and then answering some questions to ensure you have gone through those reading materials. After which there will be lots of interactive webinars and other stuff where you will be showing cases and taking through all the important, say, about what are the fractures around the knee joint, what are the ligament and meniscal injuries and the knee joint, what investigations will you do, for example, in MRI, what sequences you will use, how to report them and how to find out. Now, the other thing I want to emphasize is this program is not only a bunch of webinars. It is very heavily based on cases, and you will have to look through the cases and the cases will be shown to you as well. It's a very heavily case-based training program. And each week, not only you will be going through the cases, but you will be given cases to report, which can be anything between 10 and 20 cases per week. And those reports will be checked by your faculty, and you will be given feedback on what are the things going wrong, what can you do to improve. So it will be very heavily interactive in that way. For example, in the knee module, after you have done the reading part and you have gone through some of the important webinars, then again, there will be questions for you to answer. And then you will be given some cluster of cases for you to report, and that will be checked. And then in the active session, your faculty will go through those cases and then also have an extensive case-based discussion. And following which will be given another sets of cases to report and make sure that you have improved and your reporting is at par of the standard that we want you to be. So as you can see, this is just 1 week of one module. We are going to replicate this for every week, making sure you cover all aspects of MSK. Similarly, we'll be covering all aspects of chest and cardiac, GI, GU, pediatric, breast, so on and so forth. And that is what is unique about this program. It is trying, even though it's in a hybrid format, it is trying to replicate the exact training that you would have received if you were a trainee in Oxford or in London or in Birmingham or in New York or in Michigan. So it is going to take you through the same sort of detailed program that is expected. We are also sort of planning that at the end of 2 modules, which is twice a year, every 6 months, we will have a face-to-face meeting in Hyderabad, where all of you will be invited to come. And also all the faculty who have been teaching you for the last 12 weeks will come to that program as well. And in that short, say 4 or 5 days program that we'll have, we will not only discuss more cases with you, and you will have the chance to network, to talk to your faculty, and then gain more knowledge and inspiration from them, as well as making sure that you have achieved all that you need to achieve while doing the last 2 modules for the 12 weeks. I'll just talk a little bit about the faculty. So you know what? The faculty, I'm proud to say that through all my contacts and Raju's contacts, we have got the best of best around the world. I'll give you an example. Say for chest and cardiac, Professor Sujal Desai, who is the professor of chest radiology in Imperial and considered to be one of the world's best chest radiologists, is the faculty lead. He is joined by Simon Padley, who is again another professor of chest radiology in the Brompton Hospital in London. Say, for example, in vascular and intervention, Dr. Sanjeeva, who is the professor and head of Department of Interventional Radiology in Harvard, is going to be our faculty lead. For example, again, in pediatrics, I will personally teach you in the pediatric radiology, along with my colleague, Ashok Raghavan, who is a senior pediatric radiologist in Sheffield, who is going to come and teach you. So for each and every faculty, we have tried to get the best that is available in the world. Now, why are all these people coming and teaching you? One thing you will notice, barring a few exceptions, all of us are essentially Indians who have our links to India, roots in India, and we have reached some part of our career where we want to give something back to India. And that is the main driving inspiration. Why am I spending all my time doing this? And that's the one. It's not earning money. I can earn much more money doing private practice in the UK. But this is something which I'm quite passionate about. And I hope that it will enthuse you to join this program and try to impart all the knowledge and expertise that myself and my rest of the faculty have gained over the years and decades. And hope that you all become as good a radiologist that you are capable of, and you will be at par with anybody in the world. And that's the whole ethos or the principle of this program. Now, I think we'll open up the house to any questions you have. And Neha, will you be coordinating the questions?
Yes, sir. Yes, sure.
Neha, what we'll do is by default, we'll answer the questions alternatively. So one me and one Ash. But if we feel that one of the other person can answer the question better, we'll pass on between ourselves. Yeah.
Sure. So we have a question from Vishwanath saying, will the program be equivalent to doing a mini fellowship in all the systems?
Yeah. We haven't labeled them as mini fellowships. They are a comprehensive training in each module, and you will get an end of module completion certificate signed by the faculty in that module. To that extent, it is like a mini fellowship, but it is not equivalent to the next level that we're going to do, which are actual subspecialty mini fellowships. For example, we're doing one in November with Harvard faculty, abdominal mini fellowship, but that will be a very tertiary level, super specialized fellowship that is meant for people who have completed the GRTP or who are already practicing radiology for a long time. So this program will have 8 modules, and those modules will all be completed, and then you will be assessed, and you will get a end of module certificate signed by the faculty.
Yes, I will just add on to that is that if I take pediatric radiology, for example, what do you need to learn about pediatric radiology as a core training is sometimes quite different from what do you need to learn about pediatric radiology if you want to do that as your career or you subspecialize in that. Say, for example, things like, say, intersex and gonadal dysgenesis and say detailed analysis of all pediatric tumors and what should you do about them. They are not sort of part of the core radiology program, but they are something you need to do if you are a pediatric radiologist. So there is some overlap, but I think calling each of the module a mini fellowship is, as Raju said, is probably not the correct thing to say. These are each of the modules will be in quite a bit of depth, and you will get probably a lot of benefit like a mini fellowship program. But it is like the springboard for you to be subspecialized more in whatever specialty you want.
There's a question by Sunil. Will there be any job opportunities in UK without FRCR after completion of this course?
I will answer that. No, this course doesn't give you a job opportunity in itself. So there are 2 ways to go to UK. One is completing FRCR will give you the eligibility to register with the GMC, which will then make you eligible to work in the UK. If you do get a GMC registration, then this course will definitely enhance your chances of getting a good job, because you will be able to document in your CV that you've done all this training from all the UK faculty. You can list out the names of who taught you, which will undoubtedly make your CV much stronger compared to any other international candidate that applies without doing this program. So that way it will benefit. But the course is not a route to a job in UK. It will you will still have to get a GMC registration. There are, however, some opportunities. There is going to be one coming up very soon where the UK is now allowing some radiologists without FRCR to go and work there. So there are alternative sponsorship routes. If you do get one of those routes, again, this training program will definitely help giving the confidence to the NHS employers in the UK that you've gone through the core radiology training administered by UK trainers. So that way it's definitely beneficial. Neha, there is one part of the previous question where they asked when the program is going to start. The program is going to start in October this year. I think, to be precise, Ash, as we discussed before, 29th of September 2023 is the start date for the first batch.
That's correct. I think I can answer the first part of question from the perspective of an employer in UK. So if I have got trainees or radiologists who are applying to work in my department, whether they come through the FRCR route or whether they come through the direct route, one of the things we want to make sure whether this person will be safe to work as a radiologist with my patients in my hospital. And how do I do that? Now, the problem that you can find in India is that there is no central governing body, like, say, the Royal College of Radiologists in UK or the American Association of Radiologists in America. You can get your MD or DNB from any of the numerous training programs. And then there is no assurance about the quality of these training programs, what you have really learned, and whether how do I ensure that you are good enough? Now, the advantage of the fellowship exam is that it is a bit of a benchmarking, that at least you have passed the exams. But then also we have a problem. Exams and training are quite different. Exams can be passed in various ways. Now, this program will help you in passing the FRCR exam. So that is true. That is going to be another help. However, with this program, what you will display is what exactly your training has been. And that will be absolutely invaluable for you to stand out amongst all other applicants about why you are better than the rest of them. And that is going to be the main advantage.
So we have a question again from Sunil saying, what if we have a duty on the time of webinars, being a working radiologist?
Yes,
Ash,
and that's why I was saying that most of the passive learning, which is for about 4 out of the 6 hours, you can do it at any time. It doesn't need to be at a particular time. Most of them will be available on the website, and we will monitor how you're doing them, but you can do it at any time. The weekend face-to-face one, obviously you will have to do and be in person. And that is why we have kept all the face-to-face programs over a weekend, Saturday or Sunday, when it is hopefully going to be much easier. So yes, we are, and also we are taking into consideration of the main festival holidays and other things, so that we want to ensure that you go through this training program, but not at the cost of your personal, family, or professional life.
So which subspecialty of radiology will be most affected by AI? Will neurology be mini fellowship be introduced soon?
okay, I will answer the first part
Neurology.
of it. So in terms of AI, well, this webinar is not meant to go into depths of that, but see, there are certain areas where we know AI is already playing a big role. Chest, for example, chest radiology, chest X-rays, and nodule detection on chest CT is one. And CT brains, where it's being used for brain bleed detection, stroke detection, etc. So, so obviously, it's not the right platform to go into more detail than that. But what I can say in relation to this program is the introduction of AI is going to slowly, incrementally take away from the radiologist one aspect of what we do, which is detection of abnormality, right? So detection of abnormality is something that we do, and then we follow it up by interpretation and communication. I think it makes it even more important. Introduction of AI it makes it even more important that we are clinically oriented, so that we maintain our value as radiologists. And for us to be clinically oriented, we don't just need to know, or it's not enough to know that there is a nodule on the lung, or there is a lesion in the liver or the kidney. It's even more important to know what that means to the patient and what that means to the treating physician or surgeon. So to be able to give that answer, you need to understand the clinical management and all those other aspects, which will be given extreme importance by the faculty when they're doing this teaching. So that is another big difference that you will notice if you join the program. It just doesn't teach about detection of abnormalities or describing them. There will be a lot of emphasis on giving meaningful clinical reports. And the best way to beat AI is being human and using your human intelligence to produce clinical reports. So I think that way it's quite important. Yes.
Yeah, I agree with you. I think I have seen the development of AI, and I have been part of quite a lot of AI projects in Oxford as well. The thing is that it's inevitable. You can't stop it, and you should not be able to stop it. What it does is it changes the role of radiologist, as Raju said. You remember that in UK or America, we call ourselves clinical radiologist, CR. So why is the word clinical important? Because where we come in is not acquiring the images. So even when I started training, we used to do all the barium enemas and IVUs and everything else. So radiologists these days are doing less and less of image acquisition. We have got sonographers who can do the ultrasound scan. We have radiographers who do all the fluoroscopic studies. The CT radiographers get the CT images. So the role of radiologists in the last 2 decades have changed, being from one who acquires the image to number 2 who interprets and liaises with the clinical team for effective management. Now with AI, what can happen is that some basic interpretation also may be done by AI. So that's fine. What important thing the radiologist will do is being the interface between that basic interpretation and acquisition of image and the clinical team. And that's where the term clinical radiologist is so important. And that is not going to be taken up by AI. So I can tell you in the UK that the radiologists are now in the center of most of patient management. For example, being a pediatric radiologist, if I give you an example, if a child comes with an abdominal mass, a 2-year-old child is sent by the JP, general physician, for an abdominal mass. It comes to the radiologist who decide what tests to do. And for us, even it's a tumor, that the radiologist, interventional radiologist will get the samples. And then the pathologist will come up with a diagnosis. And then there will be an MDT, multidisciplinary meeting. But the radiologist, so I chair the regional MDT for tumors in Oxford and the surrounding 5 counties. So we will present the case, and then we'll have a clinical discussion, and the patient's treatment starts. And then we will also do the follow-up imaging and other things. So what you see, the role of radiologist is not pivotal, and that being a clinical radiologist. And that is what we are trying to make you also do. So as Raju said, there is a heavy emphasis on clinical correlation. And your reports also are not just factual, some bullet points of the observations that you see on a scan. It's the interpretation in the light of clinical situation and with a conclusion and an advice what to do next. And that thing, if you start doing that, then you get the respect from your clinicians, that you are not just some sort of a technician who churns out factual reports, but you are the one who they can come and discuss the patient and also get your ideas about the management. And that is the fundamental shift, that an AI is going to drive that change more and more all across the world. So it's not going to replace radiologists. It's going to change the role of radiologists, and that will become more and more important in years to come. So I don't think your jobs are at a stake, but what you need to do is to adapt yourself to be as relevant as you are now.
So we have a question from Sunil. I'm working in Middle East. We will have duties on weekend too. I mean Saturday and Sunday. How to manage the live sessions?
Sometimes, it is difficult for us to be catering to the individual issues and problems for everyone. That, you cannot run a program like that. So I think you might have to negotiate at least a couple of hours or 1 or 2 hours on the weekend to devote for this teaching. That I'm sure if you are talking to your employers or your departmental superiors, they will all understand the need of it. Because at the end of the day, you will become a better radiologist and better employee for them by undergoing this program. So yes, I think, people from Middle East or other parts of Africa or say different other parts of Asia, everybody will join. It will be difficult to cater to everybody's individual issues, but we are trying to keep it as much easy for you to do the whole program as possible. And yes, sicknesses and other things and all other things of life will happen during these 2 years, Nobody is immune from them. We'll try to make sure that you get back the training that you have missed. But yes, you have to have some commitment from your side as well.
So we have a question from Karthik saying, can we pay the fee in 8 quarter or 5 quarter installment?
I think that question is better discussed with the team that is handling admissions, Neha, not on this panel.
Sure.
There are individual arrangements that can be made, but it's better.
Yes, sure. And we also have a question regarding, can we do the customization of the 10 modules, as in just pick 1 or 2?
No, because that defeats the whole purpose of the training. It's not a individual tailor-made for each individual requirement. Like in UK or USA, if you want to join the radiology training, you have to go through the whole thing in order to be, how will we certify otherwise to say that you have done the training and you have reached a standard that we want you to reach? So the answer to that question is no. There will be, the modules will be run in a particular fashion, in a particular sequence, and you will have to participate in all of them.
So there's a question from Neha Nancy. How much pediatricians are allowed to do reporting in UK or US? And is that playing a role in in the decline of radiologists taking pediatric radiology fellowship now?
There is no decline in people wanting to take up radiology, pediatric radiology fellowship. I have been a pediatric radiology trainer all my life, and I have innumerable registrars who have learned pediatric radiology with me, and they are consultants all around the world now. And I can tell you that pediatricians do not report pediatric radiology. That doesn't happen anywhere in the world. They can form an opinion, and often they look at a scan and make an idea themselves because they are not relying on the report that has been provided with the scan. And why are they not relying? It's again because of the credentials of the reporting radiographer, radiologist. And if you go through the program, you will get the enough credentials and enough knowledge and enough clinical guidance to make sure that your reports are not only somebody looks and bins it, but it's somebody who the clinicians read it with interest and takes an idea about what to do next. So I don't think pediatricians are stealing the thunder for pediatric radiologists. And there is a huge, huge demand for pediatric radiology across the world. And in UK, and I can tell you, there is an absolutely massive demand for pediatric radiologists.
So there's a question from Deepa Shri. Can a DMRD radiologist qualify for this course? And what are the chances of passing the FRCR exam after completing this course?
I think the chances increase. So sorry, Raju, you go ahead.
Okay. So DMRD, we can accept. So obviously the minimum requirement is that you complete 1 year of postgraduate training. So we will accept DMRD candidates into this program. As far as the chances of passing, all we can say is that the chances will be significantly better because this program is designed to be on par or in similar to the training in the UK delivered by the UK faculty. So you should be no different in terms of your chances of passing than a UK trainee themselves. So that's the best we can tell you. We can't obviously tell you that you will definitely pass the exam. There is a lot of individual component into that, but your training will be more or less similar to a UK trainee at the same level of training. That much we can assure you. Ash, if you want to add something.
Yeah, no trainer can tell you will pass the exam. Even if I have got a registrar in Oxford who is training with me now, and say there are 3 of them at this moment in my department, and I know 2 of them are going to sit the exam, FRCR exam at the end of this year. I can't give them guarantee that they will pass the exam. As a trainer, what I can do is to train you in the best of my ability to enhance your chance. And same thing about this course. As Raju said, it will be done in a way that all the trainees in UK are trained. So your chances of passing the exam will be far higher if you have not. But does that give you 100% guarantee? No, it doesn't, because nobody can give you that. Exams, a lot of it depends on how you perform on the day as well. And that is something that you will need to work on.
So there's a particular question from Vishwanath. He's been saying that his wife is a non-academic junior resident working in the radiology department for almost 3 years with good hands-on experience. Interested in taking up the FRCR exam. Will she be eligible for the program and will it be useful for her?
I will answer that question, Neha. First thing is, Vishwanathan, we will have to look at your wife's position as an individual thing, because it sounds like she's not in an accredited training program. So we need to understand what she's been doing, number one. Number two is whether she'll be eligible to take up the FRCR exam or not is up to the Royal College to decide. I think they will decide on the eligibility of the exams themselves. But the program will be useful if she is eligible to take the FRCR. The program will be useful, as we've been discussing, in preparing her for the exam, because it's a wider training program similar to the UK training. Now, you also say that there is a separate FRCR training program coming up. As far as we are concerned, we do run FRCR courses, but they are very short, 4-day courses meant to give people the techniques of the exam and prepare them for the exam. But they're only 4-day courses. They are not a comprehensive training program like this program is. So there is no other long-term FRCR, at least that we are planning. So other than this Global Radiology Program, which is a 2-year program, and 5-day dedicated FRCR exam courses.
So there's a question from Sunil. Will there be any final exam after completion of the course or each module?
I think I can answer that. So most of them will be, when you finish a module or a pair of modules, you will go through the assessments and to make sure that you have reached certain capability before you go on to the next module. We are not planning to have any exit exam, as to say, because that doesn't, again, that is not the main principle of this program. We will be taking, even within each module, as you grow from one week to other and you move from one topic in that module to another, you will be constantly assessed. So the assessments will be constant. And as I said, at the end of it, you will get an analytical report of how you have done in all of them. So no, there is no end of the course final exam. I think you have all got enough exams in your life to add one more exam.
So there's another question. How often do we get to meet the faculty members in person?
Yeah, it will be twice a year, each about 4 or 3 to 5 day meet that will be in Hyderabad. Apart from that, every weekend you will be meeting a faculty anyway. And there you can discuss the cases, ask questions in, whatever uncertainties you have, and they will take you through those as well as very heavily case-based discussion as well. So yes, you'll be meeting your faculty virtually every week for the duration of the module, and you will meet them face-to-face when we have that get-together in Hyderabad, where all the faculty will come and the students will come as well. Any more, Neha?
Is it mandatory to meet them in person? Is it
I think it's for your benefit, isn't it? I thought that that is going to be one of the jewel in the crown, to meet all these people who are famous in their, for example, a lot of them are people who write all your textbooks, whose articles you read on the, on the web, and they are, say, the best of the best in the world. So I thought that the opportunity to meet them in person and interact with them is going to be very, very important and very valuable. Now, as somebody from Middle East says, that if they cannot come for a particular one, we will probably make sure that, there is a way of virtually interacting as well. But I think I will personally say it is an opportunity for you to come to Hyderabad during the face-to-face meeting them in person, talking to them, chatting to them, talking about your career, what you want to do, what is their advice. Those things, I think, sometimes can be a bit difficult to replicate on the virtual world. So I'll thoroughly encourage you to come and join those face-to-face meetings.
So Dr. Virendra asks, so currently I'm working in my old ultrasound clinic. Earlier, I have reported CT and MRI. Currently, no access to MRI and CT. Can I take up this course?
Absolutely. I think, this is part of the reason of doing this course is to refresh your training or, enhance your training. So there is no reason why you can't take this course. And in fact, this course might help you to retrain you in CT and MR and make you ready for any other job that you might look for. So yes, you will be eligible to take the course. Just one more thing I would like to add, Ash, on, if that's okay, is you already discussed about how this program is going to be heavily case-based. I just want to reinforce that because the software that we're using, the software platform that we're using 2 of them. One is a learning management system by Medvasti, and the second is an image-based software platform from Collective Minds. What that will allow you to do is not only review the cases, it will allow you to interact with the faculty. You make your comments, faculty will respond. You will be doing reporting, the faculty will kind of comment upon, give you feedback. So that is the main benefit of this course, is that we are not just giving you a bunch of lectures from this faculty. It will be you actively involved at every step and getting feedback and trained by the faculty. So that's the main distinction that we want you to make.
I mean, just to qualify what you say even more, like the Collective Minds or the image software that Raju has just mentioned, is a fully operational DICOM software. You will not only be able to scroll through the images, screen, window them, pan them, zoom them, but also go through the various sequences like in MR. And in some of the cases, like again, Raju said, there might be quizzes with them. So you look at an MR of a knee joint, like going back to the MSK module of knee trauma. And then probably there will be a reporting template and use that template to report that scan. So find out all your findings. And then you will be able to check it, how many you have missed, what you have done. And again, during the interactive teaching, having that DICOM software at your disposal will make it much, much more realistic training. So as if somebody is sitting with you in front of your PACS monitor, going through the case and teaching you how to interpret them and how to become a better radiologist by using all the functionalities even better.
So Dr. Sunil asks, in the Middle East, Indian degree has less value. Will this add any extra value?
It will definitely add, this is not a degree, but this is what it does. It's a high quality, structured program, which will give you the credential to say that I have done my MD from wherever you have done it from. But in addition to that, I've gone through this training and this is the training I've received. So obviously what it will do, it will add to the value that you already have. So it will add your value to for any sort of applications or job appointments or anywhere you're going. And the other aspect, I think, is also, sometimes as a professional, we need that self-respect, isn't it? In you need to realize that if you are a good radiologist or not. And to do something for the rest of your life as a professional and knowing that you are not that good is a terrible thing. And that is what I think is also quite important. I hope by going through this program, and we will make you work hard, that you will become a better radiologist and will be respected not only by your peers, by your patients, by your clinicians, but you will also have that understanding in yourself that you are good at your job. And I think that is very important.
So Dr. Sunil also asks, after the end of the course, will each professor will give credentials that we are trained under them?
Yeah,
Yeah.
I think we already addressed that. At the end of each module, they will get an end of module certificate that will have the signatures of the faculty. But in addition to that, as Ash has already discussed, there will be a very detailed breakup of what they've done. And this is where I think I want to reinforce again and again that in your CV, whether it's Middle East or UK or the US, if you mention that you have undergone this training and provide the names of the faculty that were involved in your training and a bit of detail of what kind of training you've undergone, that is a very big boost to show to your employer that you have gone through a structured program. Because quite often, if whether you're training in India or some other countries, you will have a degree, but not enough evidence to say what you've done in that degree. So as Ash said, degree, qualification and training are not always the same. So you will be able to demonstrate in objective terms that you've gone through a detailed, comprehensive training program and delivered by some of the best in the world. And that's where your employability will go up. Next question is very important. So I will immediately answer that.
Yeah.
The question is, will it help?
You are much better placed answering that, Raju.
Will it help in Caesar? Yes, it will. So especially if you already have 3 years of training or experience in radiology, and if you're looking to get a Caesar, the Caesar will require two things. Number one, 5 years of experience in total. And the second thing is an evidence that you've gone through a certain amount of training and have done certain amount of reporting. What this program will do, and quite often Indian radiologists who apply for Caesar struggle in producing that evidence because we do a lot of work here in India, an enormous amount of work, but there is often no record of what you do. So when you're trying to produce that evidence, you struggle. To some extent, this program will help because there are testimonials required in Caesar application from your trainers. So the trainers in this program, what we give the digital certificate at the end will clearly say what you've done. For example, in chest radiology, you know, certified by Sujal Desai and Simon, it will say that you looked at this many cases of interstitial lung disease, or you've done so many cases of lung cancer. All that can go as evidence in support of your CSR application. Again, this will not be the entirety of it, but it will be a strong evidence that you've gone through a structured program. That's what CSR assessors will be looking at. So it will help, in short. Anything else, Neha? Any more questions?
So I think we've covered enough questions.
Anyway, Neha, you can give all the delegates our contact email addresses and all.
Sure,
And if they have
sure.
any further questions, and also to go to the website, ARI website, to have a bit more idea about the program. And if there are questions, we'll be happy to take your questions and answer them.